Joining us right now to talk about the coronavirus pandemic and what happens next in the United States is former FDA Commissioner Dr. Scott Gottlieb. He's a CNBC contributor. He's also on the boards of both Pfizer and Illumina. And Dr. Gottlieb, it's good to see you today.
Thanks.
I know we've had a lot of these numbers kind of floating around out there, but it took on a new significance yesterday. When you hear the president talk about it, you hear Dr. Fauci talk about those numbers and think 240,000, even if we maintain social distancing. What has to happen? Can we bend the curve effectively, even if that number is the model, if we're doing everything we're supposed to be doing by staying at home?
Well, I still think we can. Those things are hard to model. It's hard to fully bake in the impact of the mitigation tactics that we're employing right now, the social distancing. And we're seeing it have some effect. I mean, San Francisco looks like they're coming down their curve. Seattle really hasn't come up their curve, even though they had a large cluster and did a lot of things wrong early. It seems to have had an impact, the mitigation techniques that they've adopted there. And New York may peak next week. New York does seem to suggest signs of slowing infection. So these approaches do work. And you look at cities like Chicago and Boston and Philadelphia and Detroit, which are going to have large outbreaks. They implemented some of these measures earlier than other cities, and hopefully it's going to have an impact and be reflected in the numbers over the course of the next 2 weeks. I think the real wild card here and the decision point on whether or not we're going to have the bad outcome that Dr. Fauci and Dr. Birx talked about is what populous states like Texas and Florida do that really haven't taken aggressive steps. Even now, they're large states. They have large urban areas that have very dense populations. And if they don't get more aggressive, then we could be on the cusp of some of those bad outcomes. I think if those states start to act very aggressively right now, we could keep this hopefully well below those kinds of models.
If that's the case, why don't you think the administration has taken a firmer stance with the governor of Florida and pushed him to take some of those steps a little more seriously?
Well, look, the administration's outlined pretty firm guidelines. There is a tradition in this country, both under culture and law, that a lot of public health decision-making is left to states and local authorities. The federal government has limited authority to impose public health restrictions on states. You can quarantine, potentially, a city under the quarantine rule. Under federal law, if you declare a national disaster, you have certain authorities. But they're limited authorities. These decisions are left up to states and governors and mayors to make for their local populations for good reasons in a lot of cases, because there's a lot of variability in public health tools across the country. There's a lot of variability in how disease is experienced and how epidemics spread in different parts of the country. And you want local officials to be able to adapt measures to their local populations. So I don't think that the federal government's going to step in with a much firmer hand on these states other than perhaps just increased jawboning. It's really up to these governors. I just don't think you're going to see anything more from the federal government trying to force these states to take these actions. They've said what they've said, and now it's on the governors. I don't understand why those governors have not acted more forcefully right now, especially when you look at a state like Florida. Florida has a very large epidemic underway. There's multiple hot spots. They probably were heavily seeded sometime in February. This was not New Yorkers coming down in the last 2 weeks. This was infection that started to spread early in February, and now they have large clusters all growing up simultaneously. It's looking a lot like New York, only 2 weeks behind. So they should be taking much firmer action in cities like Miami and elsewhere in that state right now.
They have an older population, too.
Exactly. They have an older population. They have nursing homes down there that will be highly vulnerable. Now, they have a break as well. They have a warming climate. It's 80 and 90 degrees there and getting humid. And the heat and the humidity will be somewhat of a backstop against this virus, but not a complete backstop. This is a very novel virus. It's going to still transfer in warm weather, but it's going to help them. So they ought to take advantage of that lucky break, that the fact that this started to spread as they were warming, and start implementing aggressive measures, because they can get themselves out of this and prevent a bad outcome. But I do worry about that state and the other large states that haven't been as aggressive. If they don't take more aggressive action soon, I think the kinds of numbers that Dr. Fauci and Dr. Birx talked about could come to fruition. I think if all the states take this seriously over the next 3-4 weeks, I think we can get out of this with hopefully a better outcome than that.